Well, thank you, and I am so happy to see all of your faces at our first Chapter 2 workshop. This is the next step for our survivorship program and the focus that Roswell has on survivorship, and I'm hoping that you give us lots of feedback, both on Roswell and on your experience during this workshop, and spread the word, because this is only the beginning of where I think we're going to go in the future. I'm also going to say that I got back from Scotland last night. I was awake on Scotland time, so I'm likely to make slips, maybe not exactly like the last one, but you're going to have to be. And I might not be as graceful about it, but anyway. I wanted to just give you sort of a conceptual overview, a broader look at where survivorship is right now and where we hope to go. We are in the infancy of developing our program at Roswell. It's been a long time coming. I've been in this position a couple of years. If you know me, you know I am intensely enthusiastic about changing how survivorship exists at Roswell and for cancer patients in our community, in the broader Buffalo community. And I think as we go forward, the thing that's really going to drive and make this a great world-class program is the feedback and the guidance that we get from people who are surviving and living with cancer. So, when in integrating this model into a cancer center, it's how do we define survivorship? And technically, the National Cancer Institute defines it as the minute you get diagnosed. Now, the focus of our program right now is when you've stopped treatment and you're moving forward in Chapter 2. But it's our vision and of us collectively in the program that we want to move what we're learning about living with the effects of cancer into the cancer treatment model. And that is our goal, so that we really begin to address all the issues that we identify at workshops like this into when you get diagnosed. Because theoretically, the issues that come up at the time of diagnosis last you for the rest of your life. We know that survivorship, and when you finish treatment, for example, covers a lot of physical consequences that include limitations, changes in how your body's functioning, changes in how you see your body, to psychological stressors that accompany facing a life-threatening illness, and the challenges with finances and families and this forced redefinition of what life is. When I started this job, my husband was diagnosed with stage 4 colon cancer. He's doing very well, he's disease-free, but I can tell you that I personalized that experience in the way that we've approached this program. We also know some things about survivors. We're doing a better job up front with treating cancer, and we're getting, many diseases, the survival rate has been outstanding, and the survival rate is getting better with diseases like lung cancer and pancreatic cancer. We also know that facing us in the future, survivors are aging, and aging has its own consequences in terms of risk of cancer and risk of second cancers, but it also has consequences on sort of the things that you need to do as a survivor. It changes the context. Right now, the majority of cancer survivors are 60 to 80 plus. And it's not just about the disease, it's that people live longer. And so we know that if you've been treated as a young person, treated as a 40-year-old woman with breast cancer, you're going to be a survivor. You could be a survivor for 40 years. And we have to address that as we move forward and tailor our approach to that idea. We know that symptoms among survivors are substantial, and that pain, numbness, nausea, incontinence, bowel incontinence, vision, there are multiple symptoms that you carry with you into that next phase of your life as a survivor. and they're substantial. I mean, people have multiple symptoms and really large groups. And as we learn more about survivors, I mean, this is still a new field, we have to target what we're doing, our programs, to actually addressing those ongoing symptoms. And the effect of aging, and this is a very big field that's emerging in cancer, that we know that just the many basic systems on a molecular and cellular and genetic level are affected with age. Age is the single, biggest risk factor for cancer and cancer recurrence. And as we get a handle on how to diagnose this, how to use an aging immune system to your advantage, how to adjust nutritional competency with age, this is a big factor, and it's something that we have research programs here at Roswell, and I think the field is starting to acknowledge that age plays a role in many ways that we really didn't understand. It's not just a number. We also know that our systems, and this happens here, and it happens in most places where cancer is treated, that there are many unmet needs for cancer survivors. And this came from the advisory board, which surveys cancer centers across the country, that symptoms and side effects that are persistent, 75% of cancer survivors feel that those are not addressed in their current treatment system, that they're unclear about what tests and treatments need to be done, both for surveilling your cancer, your primary cancer, but also what do you need to do to anticipate any other cancers that might come up. There's a substantial 64% of cancer survivors do not feel that they get the information about health promotion, interpersonal and emotional support, psychological support. And this is, the advisory board is pretty mainstream. And so again, we are going to focus our energies on the things that we now know about cancer survivors. The other part that is significant is the caregivers, the support system for cancer patients and survivors. We know that the unmet needs for cancer caregivers for many years persist on many different levels. And we have to start addressing that and preparing people who are survivors for what to anticipate. Because if you're prepared and you have some knowledge, either in dealing with the long-term financial aspects of cancer or the medical or the psychological, we know that there are that this persists for years after the cancer is gone. So the philosophy of our program at Roswell is sort of fourfold. It's really to support the patient and family in a patient-oriented way. And I'm getting a lot of support from the administration at Roswell, but this is patient-oriented. And when I talk with survivors and I'm looking for support for additional programs, this is oriented towards the patient. This is not about how the medical staff feels about it. It is not about, it is to tailor treatment and support to the person. And that is a big driver in our program. It's to individualize a care plan that will provide the map for the future. There are professional organizations that are forcing us to write care plans. And that's really the reason why it's coming about. And I am very supportive of that. We now went live at Roswell with a survivorship care plan that is in our EHR. It identifies for the clinicians when this has to be filled out. And Linda Bopen will speak in a little bit about the components of a care plan. But now every patient who finishes treatment, within 6 months of finishing treatment, will have an individualized map of what they should expect It can be changed, it can be tailored, but it talks about testing, it gives you a treatment summary. We will communicate with your primary care physician. So it gives you a map of what to expect, and it gives you an opportunity to say, I'd like to speak to a nutritionist. So it really provides an opportunity to get access to the services that we either have here or that we've identified in the community. And the goal of this program is to improve your quality of life. I mean, that's the metric. If we're building a program that doesn't improve the lives of our survivors, it's not working, and we will have to change it. But it's to support survivors and their families to improve their life and to improve their health outcomes. This is kind of the components. We have a clinical center. I'll talk a little bit about that. We are integrating in many of our support services that we already have at Roswell and enhancing them. We're getting a new physical therapy center. We have psychology embedded in our clinic. We have a nutritionist we're bringing in that is full-time to see our survivors. We're working with Dr. Kelly's team to really bring in integrated therapies, and we're really building a capacity to do cancer screening, because we don't want that cancer or any other cancer to come back. We don't want someone who's survived life-threatening cancers to die of a cancer that was preventable. And that's the other part of our program. So the clinic is an annual or semi-annual visit where we will work with the oncology team to provide the surveillance testing. We are going to do comprehensive assessments. And I was talking with Doug McDaniel this morning to say, we don't need you to tell us what you think you need. We need to ask you. We need to provide a standard assessment that says, you seem like you need to see a nutritionist. Do you want to do that? We need to offer survivors the opportunity to take advantage of support services. We have a super scheduler on our team who can actually coordinate appointments so that if you come in and you're getting a CT, you can also see a nutritionist on the same day, so you don't have to come in twice. We also are working with building a network of practitioners in the community, because we can't do everything here, and we don't necessarily want you to always have to come to Roswell. So we want you to know about people in the community who are like-minded, who specialize in cancer patients and survivorship. We are strengthening our communication with your primary care doctor, which is a really important thing, because there's tests that you need done that are more of kind of general medical testing. We don't want to repeat them. We want to coordinate what needs to be done in the community that may be easier access to you, and what do we really need to do. We are the cancer specialists here. We want to do the surveillance. We want to make sure you have the kind of follow-up testing, but everything doesn't need to be done here. It has to be at your convenience, which I think is really the direction that this has to go, because this is you're living with this. You have to schedule appointments, you have to leave work. We want to make this an experience that matches your needs. Again, we're providing comprehensive screening. Not everything has to be done here. We're working with providers in the community for colonoscopy, but we do breast cancer screening, pap smears, prostate cancer screening. And we want to offer patients who are survivors an opportunity to participate in research, because we are building a research program here. Research is not a it is a positive experience. It offers people an opportunity to contribute to knowledge, to improve the standard of care, to participate in novel therapies. And so we are actually building a program, and we'll be offering people and caregivers an opportunity to be in research, which I think is a very, very positive step. So I don't need to read these out, but this sort of is a comprehensive list of many of the support services that we're focusing on. Again, the idea is to find those things that will help you to lead a better, more enriched life as you're living with surviving cancer. We have an expanding integrated medicine program at Roswell under the leadership of Dr. Kara Kelly, who you met yesterday. She is bringing tremendous expertise to Roswell that we never have had. And I think as the time goes on, as this program builds, our capacity to actually do more here, to get it into when you're diagnosed, will build. But it's really about enhancing your sense of well-being, putting the options to you, what make you feel better, and to provide a discussion with the oncologists. You know, we know that 85% of cancer patients under treatment seek out some kind of integrated medicine and yet don't report it because they're worried about how their oncologist is going to accept what they're doing. And we need to really break down that barrier. And I think we have a tremendous potential coming up. There's many of these services offered today that hopefully you'll get to experience and learn about. But this is a big component of our survivorship program. We also are doing more with wellness. We have Brian Whitmire, who's the director of wellness, who's been here for a year. We're expanding rehabilitation, physical therapy, and occupational therapy into a beautiful new center on the ground floor. We're going to be providing more exercise classes. We've started a yoga class for survivors, which we're seeking money for to push that out for 12 months out of the year. We have a space for healing touch, for meditation, for massage. And again, we really want to educate you on what opportunities are out there in genetics, in prevention, in how to change your lifestyle, to really improve your level of wellness and sense of well-being. Again, this is about empowering you as survivors as you go forward. So survivorship has arrived. It's not going to go away. We are doggedly committed to improving this program and growing it. We have support. We have many donors in the community who are actively going to donate money so that this program can expand. And again, it's coupling clinical follow-up with an opportunity to access many, many other services that are available here. And we are working with the community. So this is not just focused at Roswell. You know, we would all like it if we could run things so that you could go to a place that was maybe more convenient. I know that with my husband, he does not like coming to Roswell all the time. You know, it's where he got chemo and surgery. We would like to provide in the future a place that is more wellness-oriented, that maybe is more convenient. And I think going forward, that's the focus of what we're going to be trying to do. Again, the measure of our success is about your quality of life. It's the level of wellness and the health outcomes among our survivors that are going to tell us if we're doing a good job. So we are going to survey you. We're going to send you stuff in the mail. We want your opinions. We want you to tell us what you need, where you want education. And then we're going to expect you to participate. Because if we provide programs like that yoga, Payo in the park, that was fabulous. And we did that because we knew from you that that was something you wanted. I think this is a great opportunity for us to work together as partners and really developing an outstanding program going forward. So this is our clinical team at a happy hour on a Friday afternoon. But I think, you know, we have an outstanding group, and you know, and the future is going to be dictated by us collectively. So that's all I had to say. Thank you.